Well, that's difficult to say. The stress of the pandemic, I've seen all of our providers have difficulties with the stress of the pandemic. From the early days, some of them became quite fearful of having to go into a patient's room if there was any concern that they may have the COVID-19. And there was also the concern that the personal protective equipment, the PPE, was not available appropriately for our providers to see patients. Now it's a little bit better that there's enough PPE to go around, particularly in the hospitals. I believe that the hospitals have done a pretty good job of policing the process and making sure that anybody who's suspected to have COVID-19 is immediately put into quarantine and isolated. And if they're well enough, they go home so that they can continue their isolation at home. There have been, up to date, as of today, 84 cases that have been documented in Hernando County. However, I'm sure that number is a lot higher. And as a healthcare professional, it's very difficult to know when you're out on the street or when you're in the grocery store or when you touch the handle of your gasoline pump, who before you has touched these things. So with the providers, they're at much higher risk, particularly our providers who are on the front line. We've gone to telehealth in many situations in our offices, but we can't do telehealth in the hospitals. We have gone to telehealth in some of the nursing facilities, who've also done a great job in trying to isolate and keep people safe during this process. But it's a tremendous stress on all of us in the healthcare industry, because I've been in practice and been in medicine for over 40 years. And this is the worst thing that I've ever seen during that time. And so it's just a game changer from my vantage point. So we all have to adjust, and adjustment and change never comes easy.